Okay, it's now online on my own channel, and I will put it on the channel of Hills. Hello,
Okay, yeah,
go ahead, Agbolad.
yeah. So thank you, Didier. So greetings, everyone. My name is Agbolade Omowoli. I am happy to welcome everyone to this event. And I'd like to quickly just appreciate the speakers and panelists that have already joined. So here I can see Neil Sauta, who is the speaker. Thank you, Neil, for joining. And of course, Didier, thank you for helping with the technical setup. And Harlan, hope you can hear me. You're welcome. Thank you for joining. Harlan is one of the panelists. Alok Shankar, I can see that you're online. Thank you for joining. Brenda, thanks a lot for joining. Chivaz, thank you for joining. Dr. Devi Asuma, thank you for joining. So I appreciate everyone for carving out time to be at this event. And I believe that we are all going to learn. We are going to learn some things, unlearn some things, and relearn some important things. So in the next few minutes, we will be going to a panel discussion. So thank you everyone. So Mr. Harlan, Brenda, Alokati, very set for panel discussion right now. So in a few minutes, we are going to be starting the panel discussion. So thank you everyone. In about 3 minutes, the host of the panel discussion will organize our session. Thank you.
Just for information, there are people who keep coming. That's good.
Hi, everyone. Good evening.
Hello.
My name is Ifoma, and I'll be the host for the panel discussion. Can anyone hear me?
Yes, we can hear you, Ifoma.
Okay, so okay. So I'll be the host for the panel discussion. But before we start the panel discussion, I want everyone who has a question about AI. Of course, we must have seen the topic of discussion, the whole essence of this meeting. And so if you have any question you think you may have, or while we're having the panel discussion, if you have any question, you can drop them on the chat so that we will address them later after the panel discussion. And I want to say thank you for everyone for joining, and we're going to start the panel discussion now. Okay, so we have the panelists, and on my list is Ebere. We have Ebere, we have Nell, we have Otse, we have Leslie, we have Didia, we have Chiraz. Sorry if I'm not pronouncing your name so well. we have Alan, and we have Brenda. And so I'm just going to ask questions, and if anyone among the panel is able to answer the question, the person can just unmute themselves and answer. Okay, and this discussion is supposed to take about 60 minutes. And so I'll really encourage us, or I'll encourage the panelists to give their answer as brief and as clear as they can, so that we can work with, stick to the time. Thank you. Okay, so.
Yeah.
Okay,
just
so
to add something to what you said, Ifeoma. So thank you. So just a little clarification so that everyone is on the same page. So we are having 4 panelists.
That's cool. That's cool. Now, that will help your CV. Yeah, right. Like when I say nobody knows, although I have
Okay, so all right. So Ifeoma, please, can you hear me?
Yes, I can hear you.
Yeah, so just to clarify, so that we're all on the same page. So yeah, for the panel discussions, you're having Mr. Harlan, Didier, Brenda, and Chivas. And then, of course, the remaining 4 that you mentioned are the speakers, and they are free to also answer if they want. But most of the answers should be ideally from the panelists. All right. So that's just what I want to chip in. So thank you very much for continuing.
Okay, thank you. Okay, so I'll be starting with the first question on my list. And here is the question. What are the most pressing public health challenges in Africa that AI and data science can address? I'm going to take it again. What are the most pressing public health challenges in Africa that AI and data science can address? Thank you.
I can go ahead if possible.
Yes, of course, of course.
Well, hello, everybody. Thank you so much for having me. So my name is Shiraz Bensemans. I'm the CEO of Pitch World Fast. And we actually work a lot with the African authorities when it comes to health and trying to see how to increase access to health on the continent. And before actually answering the question, I thought it was interesting and very important to really mention how we've seen that in the last 50 years, we've made quite some advancement when it comes to health, science, and technology. So before the 25th century, there've been like, yes, some changes, but in the last 50 years, we've made more that we've seen before. So whether it's public health intervention, socioeconomic development, there's a lot of things that helped to reduce mortality and raise life expectancy. However, and this has been exacerbated with the COVID crisis, the gap within and between countries have widened because there was inequalities and whether in the absorption of the new technologies, as well as being technology like we're going to be talking about today, AI, or data science, but also technologies when we're looking at the health sector, such as new medicine or new devices. So that the disparity has widened. And when we look at our continent, we actually, COVID had made us go backward. We still have some diseases that do exist. So some of the most pressing, to go back to your question, when it comes to public health challenges in Africa, we have first, obviously, the infectious diseases, like malaria, HIV, AIDS, but our continent, besides the infectious disease, is also going through its epidemiological transition. So we're looking also at the non-communicable diseases, and we're also looking at some issues that some other government and some countries do not have, such as maternal and child health issues. So we actually have to look at solutions, and AI and data science can help through it all and could help, especially giving access to healthcare in remote areas, looking at resource allocation, disease surveillance, and health education. So that would be my piece. Thank you.
Can I chime in? Hi, guys. Thank you for allowing us to have this space to discuss this very important topic. My name is Dr. Azuma. I'm the co-founder and president of Love Your Menses. We provide period equity and trying to end period poverty in the United States and globally. Like Shiraz just said, in terms of health, I would say access to care. And I am very grateful, and I'll be giving a talk on artificial intelligence and its impact in public health shortly. Well, access to care can be corrected with artificial intelligence, right? Because now we can be anywhere assisting people locally to provide care. Shiraz talks about subtypes, right? She talked about infectious diseases. But if you have access to care, especially preventative care, as in public health, right? We like to prevent diseases. It will be very important, and AI can do that. And when I do my presentation, we'll talk about robotics in AI and how it can help in terms of remote surgeries, or we can even talk about vaccination dispensing, right? Because as Shiraz says, infectious diseases, we know the role of vaccination and infection prevention. So we are excited about AI. It has a lot of solutions in medicine, in public health, as it has had solution in social media, right? We're here today, at least I am, because of social media. Thank you.
Okay. If I may as well, my name is Brenda Ramokopelwa. I am the CEO of TEPS. It's a transdisciplinary agora for future discussion. That's what it stands for. It's a science and technology organization. And I'm also the co-founder of Afro Longevity. We really want to look at the research and promote research and awareness around longevity and encouraging Africa and the world to start looking at our health span, so at increasing our health span so that our lifespan can increase. Again, thank you so much for the organizers for putting this together. That question is a very important one because when you look at Africa, one of the key challenges that we have is around infrastructure as well, over and above what the two ladies have spoken about. And when you start thinking what AI can bring as a solution is, helping our people to ensure that they've got the infrastructure that enables them to be able to get access to all of these things. When you think about our rural areas, which Africa is vastly rural, we do not have the capability in terms of infrastructure to be able to collect our data, analyze our data, use the data to have predictive or analysis that can inform what interventions are required in terms of preventative medicine. Our healthcare system across Africa on average is just sick care. We are taking care of sick people. We are not maintaining health in Africa. We are not preventing diseases. So we need to start looking at preventative medicine. We need to start looking at diagnostics that are preventative, start taking care of ourselves and maintaining the health, not pretending as if healthcare is what it is. We have what we call sick care. We wait for people to be sick, and then we want to take care of them and provide solutions that are just looking, taking care of the symptoms, not necessarily the root cause.
Hello. Yes. Thank you, Agbolat, for organizing this. I'm very happy to see so many different people. I'm not a specialist concerning the situation in Africa, but I know quite a few things concerning health and artificial intelligence. I mostly agree with what the three very interesting people before me were saying, mostly agree. Of course, it is important to more understand about and more fight against disparities. Of course, the biggest problem at the moment one of the biggest problems at the moment in many countries in Africa is access to care. What I would say, maybe already specifically, sorry, first I forgot to say, so my name is Didier Cardel, and I'm a co-chair of an organization called HEALS, Healthy Life Extension Society. So we are focusing on healthy life extension, and we are based in Europe, but of course we are interested in life extension everywhere, not only in Europe. So maybe 2 or 3 specific things I would like to add. The first is we know that in the world after the COVID crisis, well, during the COVID crisis, but also sadly, even after the COVID crisis, there was a very clear decrease in life extension, at least a very clear decrease in life extension in the European countries and in the United States. The situation is not very clear in African countries, but sadly, maybe not because the situation is better, but maybe because there are less statistics. So having better statistical information and curated data about the most urgent situations is very important, and to understand what is the impact of the COVID crisis on life expectancy, but also on vaccination and many other aspects is also very important. And then maybe one of the very important things specific, not to Africa, but specific to some to countries in the south, is the difficulty to have drugs that are reliable. And for this, we need more, let's say, open source information, and artificial intelligence can help for this. That's it for my first intervention.
All right, thank you all for the contribution. Thank you for the answers. Makes a whole lot of sense. And so we'll be going in for the second question. Now, can you share examples of successful AI-driven or data science public health initiative in Africa? And I go again, can you share examples of successful AI-driven or data science public health initiatives in Africa? Thank you.
Well, yeah, so thank you very much. So my name is Agbolade. So I just, like the question you just asked, I believe that Africans will have more understanding of that, probably more than people who are living in the developed world. However, based on research, everyone have heard 1 or 2 things about things that are being done with AI in relation to public health. And just very quickly, I just want to say that it's better if the panelists speak shorter, all right, so that we can address all of the questions. So if we can limit the responses to about 1 minute or 2, I think that will help all of us to meet up, please. So thank you. You can continue from our please.
Okay, thank you. Okay, and so just add to what he said. Let's try to keep the questions as our contributions or our answers as short as possible. And so I'll ask the question again. Can you share examples of successful AI-driven or data science public health initiatives in Africa?
I'll go quick. So I'm checking, it's 23, so by 25 I should be done. So I wanted to talk just about 3 quick examples, and it goes ahead with what we're saying also before, how it can help with access to care, prevention, data information. So one is in Rwanda. I think we've all heard about it, the drones equipped with AI, which had been used to deliver medical supplies, enhancing access to healthcare, also in remote areas. Another one that is called MSEKU in Kenya, which use mobile data and AI for maternal and child health monitoring. And there was also a very good case to some extent of what the WHO has done with AI to track the spread of diseases like Ebola, where you would have real-time data monitoring, looking at also and using AI and machine learning to identify the patterns, anomalies, and trends, so that we can know where to go, where to actually allocate the resources, where they actually should have the right care. There's the question of early warning systems, like we were saying also, because we want to make sure also that we're providing the necessary resources and people, and not to forget in this case that we could actually, I could share even an article about it so that you will have more time to learn about it, that the question of capacity building, because we need also the partnership between the WHO and whichever institution that works with it, the government, the local health authorities, and everyone that works in it, to learn how to actually integrate the AI, how to actually use those data science, who should put on the data, how to use it so we can actually get the outcome that we want, so that we can, yes, get more access, so we can have also more preventive care, so we can have more prevention and diagnostic. So let's try to be as short as possible. Thank you.
Thank you.
Okay, so I think we can go to the next question if we don't have more response for this current question, just because of time. Yeah,
okay.
Thank you.
All right. Okay, so the next question is, what ethical considerations are important when using AI or data science in public health in Africa? What ethical considerations are important when using AI or data science in public health in Africa? 2 minutes. Thank you.
Yeah, can you hear me?
Yeah.
Yes.
All right, yeah, okay. My name is Alan. I'm an AI expert, like 7 years of experience in AI. And I've been involved in longevity in Nigeria for a very long time, yeah, at least since 2016. And I'm also a founder of a space company. So when you talk about ethical in AI, when it comes to public health system, is usually the data privacy. Because, for example, if we gather data in medical conditions, these are people's data. These are all this data are collected from people, and these are people who usually don't want their data to be out there for people to see. So I think all the ethical part of it is actually to protect patients' identity. While we train the machine learning model, there should be a way to protect the patient medical identity. Those are one of the major things when it comes to medical data gathering, and also culturalizing as well. We have a lot of, there's a lot of race. We have different race in Africa as well. So we want to make sure that there's no bias in our data, so that that also help to avoid it, to protect. It brings about ethical protection as well. So we want to make sure that the data capture both races in Africa as well, instead of having this kind of bias towards particular race and all of that. So I think the major part is that we protect patients' data, have it, blood for the public, use. We can use patient, and again, we can also have a system that allow patient to, to consent to their data. Okay, go ahead, use my data. I think that should be that should be taken serious, which is why open source in healthcare is not really that. It's not moving very fast the way it should, because people are very skeptical about using their data in this model. So they want to be very careful how this data is being used. They want to be involved in the curation and all of that. So I think in Africa, if we really want to do well in making use of this data for predictive model, we must make sure that people are involved, patients are involved, they consent to the use of their data, all of that. So I think that should be that should be something that we take very serious when it comes to, ethical use of medical data. So that's that for me.
Okay, thank you, Alan.
I will maybe, if you allow me, continue this information, because I agree, I would say, for probably 90% of I think what I would like to add is first, in Africa, you don't have the famous GDPR, so the famous privacy rules that we have in the European Union, and that can be a risk because of privacy problems, but it can also be an advantage because these regulations are really sometimes so complicated to follow that they are slowing down the sharing of health data. So you are in one place where it could be great if it is possible to really share data in an open way, but of course after anonymization of pseudonymization. So after that, the data cannot be linked to a person anymore and cannot be sold. And maybe one of the difficulties is how to have a system where health data is really shared for not for profit goals and for health goals, and not for companies to sell their drugs and to sell their products, and to use the health data maybe for drugs, but not sharing it. That's it for me at the moment.
Thank you.
If I may chip in there, maybe to add to what the two speakers had said, I will start by maybe commenting on what Didier is saying around data protection laws. So depending on where you are in Africa, there's different data protection laws, and GDPR is one of the laws that applies in most African countries. So in South Africa, for example, we've got what we call the Protection of Personal Information Act. And I'm talking about that is over and above the other information protection acts that we have. So I'm talking about the Protection of Personal Information Act because it links directly and it talks to health data. So I think for me, the bias that was spoken of, the transparency that was spoken of, becomes very important. And because from an ethical point of view, by the way, part of what I do as well as risk management and compliance, and I've spent a bit of time on data management, which is why this is a subject that is very close to my heart. The issue that we've got is the application and enforcement of those laws. It's very nice and well to have, things that are good on paper. But when it comes to enforcement and application thereof, the ethics just comes out of that. So I think, in my view, when we start implementing these exponential technologies or these emerging technologies, we need to ensure that from an AI point of view, how our algorithms talk to what we want to get out of whatever solution we have needs to also be integrated to our regulatory systems to ensure that the processes deliver what the practice and the policies requires. If we are saying, this is how we're going to share the data, this is how we're going to be transparent, this is how we are going to ensure that there is an alignment if I'm going to share my data across borders, where one country in Africa is under GDPR and then one country is using protection of personal information. Where are the disconnect and where are the interfaces? Let's ensure that we are talking to each other. So collaboration becomes important. So I think when we start talking about AI, we need to always remember that there's a human factor that needs to be considered, that becomes very important, because we are talking about people's lives here. We are talking about things that are of value to us. So we cannot afford to just rely on technology or rely on technology that has been adopted from outside without taking into consideration our maturity.
You have less than 1 minute. Okay.
Wow.
Okay. Thank you.
Let me chime in with what Brenda says. As a student of public health, data protection is very important. I mean, I would humbly disagree with you guys in terms of the handicap of data protection. I'm in the United States for just for disclaimer. And I do love the HIPAA law, because humans in general, sorry to make it very simple, humans in general can abuse power. Recently, there was an abuse of power whereby a coworker, their colleagues didn't like her, and she went to the hospital. They heard about it, and they went looking at her information. And these are intelligent people, so those laws are there to protect people. Yes, it could slow down data mining, and that's okay. That's okay. We need to put ethics first before data. And that leads to the second and the important question that Ifeoma posed here, the biases in AI. We do know that there's bias in data algorithm. We see it in the United States. We even see it in the UK, whereby they actively selected people with English names, less women, into for interviews. So we yes, there's greatness in AI. I love it, but we have to be intentional to eradicate human biases from flowing to the algorithm. So as we apply it in the apply it in Africa, we need to have Africans be involved in the process. We cannot rely on other countries to come and show Africans how to do it. Africa has so many intelligent people, and they can do it themselves. Thank you.
All right. Thank you. So I think we should just move to the next question. Thank you all for the amazing, amazing contribution. Okay, so the next question is, how can AI and machine learning help in early disease detection and prevention in African countries? How can AI and machine learning help in early disease detection and prevention in African countries?
If I may go next. Hi, my name is Alok Shankar. I am a leader at Oracle Health, where we are building healthcare products, and my team is also exploring AI in healthcare as a use case. AI is very useful for doing a lot of patterns and analysis and that kind of work, which is repetitive, data heavy, and difficult to be done by a human being. Current focus, from whatever I have read or learned about Africa, is on a lot of communicable health diseases, like malaria, AIDS, and so on. So what is being ignored is a lot of change in behavioral patterns, how people are using a Western diet or changing their health patterns. And that is where AI can help a lot. Like, is there actually a rise in heart diseases or some similar things which are completely not thought about in Africa? And AI can pitch in here by analyzing the data that is being corrected, which is something people are not focusing on. And that is where I believe AI can help a lot, and help even the policymakers make a lot of decisions by identifying these patterns and intimating them early that, hey, there's a warning, this might be coming up for a lot of population. Thank you.
Okay, I think adding to that, yeah, can you hear me?
Yes.
Yes.
Yeah. All right. So adding to that, okay, one of the best way AI can actually help in disease outbreak is through social media. We can analyze social media text data to actually know where there are disease outbreak and how far they've spread. So I think this can actually help us to know how to stop it from spreading much further, and also to know exactly how, the deadly impact and all of the severity around the very disease. It can also help in terms of, analyzing, just like he have said, analyzing, patterns in previous health cases before, to know how far they are actually changing with time, and also to help, predict if such thing will happen again in the future. So I think social media data analytics is a very good place to track disease outbreak, and also, learning from past data in Africa. I think, one of our plans in healthcare in Africa is that even if they're not curated for this use case, I think that's a major problem. And most of the data we work with, they are all Western data, So because of that, we can't actually predict what's going on in our healthcare system, how far diseases are changing, predict them very well, because we're making use of biased data from the West. So I think that's it for me.
If I can just champion, if indeed there's the question of analyzing the healthcare data, and that's something that was mentioned, is like we have, unfortunately, on our continent, a lack of transparency in data sometimes if we do not go, and sometimes actually working with ministries, to be honest with you, some of them don't even have the data. So that's even worse, because you would consider them, even if they have, some of them don't even have national health institute that do the statistics. So we are missing actually the data. This is why it's so important also to go back to, if we want to analyze this data, is who is supposed to give the data. So we have to make sure also to educate. It goes in it, because if we're looking at detection and prevention, we have to make sure that the people who are on the ground also provide the data, so that we can actually identify and therefore use AI and machine learning to identify those disease outbreaks, predict those disease trends, and recommend preventive measures, so that all those diseases that are preventable and that are costing a lot of money to our healthcare systems, that they do not have as much, I would say, they do not become that much of an outbreak. We need to analyze, obviously, our historical data, but make sure that those data are always updated, like we do with phone numbers, right? It's like our phone number, people change it. So we have to make sure to do that, because we need to identify, like this, it will help us to identify the regions at higher risk for diseases like malaria, and we can have the targeted intervention. And one example that I had that we were discussing about recently is waterborne diseases. You were talking about healthcare, we were talking about cardiac diseases and all, but sometimes I feel like we also have to see those diseases that we have in Africa that really are preventable, that are at the heart also of our healthcare system, because a lot of diseases can be prevented, and we've seen it even with COVID, that you need to wash your hands, right? So it's like, this is like, I would say like a one basic health, you need to wash your hand, but we do have a problem sometimes of having the right quality hair, water, and we end up with waterborne diseases. Well, actually, by harnessing the power actually of machine learning and smart technologies, we can not only detect, but also monitor these diseases, so that we can prevent the spread, we can save life at the end of the day, and we can alleviate those diseases that are really a burden for our healthcare systems. Thank you.
All right, thank you. Okay, so we'll move to the next question. Are there challenges in implementing AI and data science solution in resource-constrained settings? Are there challenges in implementing AI and data science solution in resource-constrained settings?
I think there are. There's a whole lot. I'm going to pick up on data again, because it's key. And the one thing about it is that, if you have data that's not available, they should speak about, and the integrity of the data becomes very important as well, because we can have these amazing AI solutions, but if you are going to do that analysis on data that is not complete, it's not correct or reliable, it's pointless. You are going to end up coming up with the solution that is wrong. Another thing is that, you can have all of these tools, but most of them will require that you've got internet connectivity, your Wi-Fi. One thing that we really are struggling with in Africa is infrastructure, as I mentioned earlier, and that applies to many African countries. So if you, simple thing like power, electricity, it is a huge thing. I mean, we're struggling with that in South Africa, and I know a lot of other African countries that are struggling with that. So if you cannot even get the power going, how are you going to get this big computing system where they're going to be able to do their work? And if the data is not there, what are you going to analyze? And, you know, it's and. So I think at the foundation of all of these challenges, one, we need to start with education. And education is not only the patients, it's not only the practitioners or clinicians, or also the health department, the people that are writing these policies, the people that are availing the resources to enable these things, so they understand the impact of them not maintaining or availing those resources, to understand that it is going to limit us in advancing, and we will always rely on the outside to do things for us. And we keep saying that Africans need to come with solutions for African problems. We are not able to do that. So maybe we need to start thinking about how do we ensure that we are capacitated and resourced.
Yeah. Yes. Thank you, Brenda, for the response. As I was listening to all of this, I was writing a process of like coming to solutions with AI. So we talked about who creates the data, who uses the data, who collects the data, who analyzes the data, and how do we implement the data. And Informa went ahead and asked us about implementation or execution of data. Before we even execute the data, let's think about HPV vaccine, right? We know HPV vaccine decreases risk of cervical cancer. So the question is the financial capacity. We see, at least in Nigeria, the data that I looked up, they spend 3.8% of their GDP on healthcare, right? That's really small, to make a difference. So we have to look at the financial capacity. Another thing that we ought to look at is the cultural biases, right? Some people do not trust vaccine, right? They think it's a way to instill diseases because it's not their fault, right? It's just when we look at the history of medicine and public health in Africa, they've harmed Africans. So it's a process, but the two keys here, I would say, is the financial capacity and eradicating cultural biases towards public health.
If I may add a technical perspective to the challenges that would be there for implementing AI here. AI is very power hungry. We need computing power. We need computers, expensive computers to run AI. And we are talking about resource constrained environments here. How do we make sure that we can actually run AI in remote places? Second is connectivity. We need internet connectivity. Now, we heard one of the panelists say that even electricity is at times difficult to make available at such places. So we can't expect that there is going to be internet connectivity for the data to be transmitted, and it's also expensive. So how is it possible to basically implement technically these solutions that we have been talking about? We have to make sure that these are cheap solutions, very affordable. In remote places, it's very hard to maintain these systems. People take government systems as nobody's business to maintain. So they get destroyed and basically are ineffective in the end. So, we have to look at some unconventional solutions. I have been working in this field for edge computing or edge AI, where a lot of oil companies or military companies use devices like edge devices. These are devices that go in a suitcase, and they actually run cloud remotely without internet connectivity. And these are devices specially designed, say they can even withstand a bomb blast, right? And they can behave as a cloud where there is no connectivity, nothing like that. So can the government and these private companies innovate in this area to figure out, hey, can we make these cheaper solutions, which are similar, portable, and powerful, still running cloud, where data can be, used at the source. We can run AI models at the source and make sure these things are workable where there is no connectivity. There's less computing resources. And we can take any computer and connect it to these solutions and basically use AI at that point. So it has to be a very deep or thought out approach where we can figure out how we can deliver cheap, efficient, and easily maintainable AI infrastructure.
I'll add quickly something and cannot agree more with what was said by the panelists, whether the question obviously of infrastructure, having the right the right electricity, adapting to our realities, because if we want to have access and provided access to others. But I also, there was like two things that I wanted to add, the question also of making sure, and I know it was mentioned briefly, the question of culture, but also the question of change management, because you have to make sure that the people that are going to be using it are adapting. And not to forget, for me, sometime I like to go like going back to basics, is how do we make sure that we integrate it to the existing systems, because we cannot reinvent the whole wheel, and we have to make sure that they integrate with our existing healthcare system. And we need to, we know that some healthcare systems are outdated, fragmented. There's a lack of interoperability. So we have to make sure that it is interoperable, that they can communicate with each other. And especially when we're looking at sometimes a bit more holistic solution in Africa, where we try to share more data, because we've seen it with COVID and we see it with Ebola, that there are no borders, right? So we need to make sure that we can communicate also on an African level. How are we making sure that our data are shared? How are we making sure so that we can react to all these things? So we have to find the solution so that it is harmonized to a certain level, and that it is adapted to each of our reality of being healthcare systems. I'm from Algeria, so we have universal healthcare. But if I look at other countries, there are a lot of countries that do not have it fully, and you have a question of budget, right? So it's like, okay, how are we making sure that we have the right funded? But besides that, also sometimes there's a question of languages. We are more French and Arabic speaker. We have the English. So all these little cultural things, all these little constraints that we have, we also have to make sure that we're not also thinking only solely country-wise, but really how it can help the healthcare system let's say to on the continental level, but making sure that it is adapted to our reality. So we don't copy paste whichever solution exists, but we do adapt it, like Alok was saying it, how we're making sure that it is cheap, that it is can work without internet, that they can have also for the remote areas, that everyone get access, because at the end of the day, that's what we're also talking is like about access to health. It is about public health. And we know, and at the end of the day, I do hope that COVID has taught us how health is not an expenditure, but it is an investment, because it does contribute to the development of our continent. And if we still consider it as just an expenditure, we're not going to go very far. So those are also mindset changes that we have to make sure, because it's great to want to go with technologies, but if we actually don't have the basics, it would be quite hard.
All right, thank you. So we have about 10 more questions to go, and we have about 10 minutes to go for this session. So can I ask that we have few people answer each question, probably just one person at a time, and that means we'll have less than 2 minutes. So we have 1 minute for each question. Thank you. Okay, so the next question is, how can AI and data science assist in optimizing healthcare resource allocation in African countries? How can AI and data science assist in optimizing healthcare resource allocation in African countries? Please, 1 minute. Thank you.
I'll take it. Brenda and Shiraz have already shared the effect of AI in eradicating or limiting the spread of Ebola through like machine learning and data mining. So with AI now, we can look at population and see where there's a high need and then address it. For example, when we think of malaria in Kenya, we can see like the outskirt, wherever needs it, now we will send resources to help them. So it's really good if there's no biases implemented in the data algorithm. Again, it's the bias, right? We know how we are. Some Africans would have biases so that their culture would get more resources. But if it's void of biases, we should be able to use our data to find where we need to send, for example, vaccinations. Thank you.
Okay, thank you. Thank you so much, Ebere. Okay, so the next question is, how can AI or data science help in improving healthcare access for rural and underserved population? I'll take that again. How can AI and data science help in improving healthcare access for rural and underserved population?
All right, let me take that. Yeah, okay. Well, I think recently we discovered that with chatbot, for example, almost everyone, I think we have a lot of people using smartphones now in Africa. So with chatbot or conversational AI, we can actually provide some basic, health assistance to people in underserved communities as long as they have internet. Yeah, that's very good example. Then we also have, just like someone mentioned before, we have drones delivering of drugs and other medical resources to rural area. Yeah, so we have chatbots doing basic, communication with people in underserved region, and also we have drones that are being powered or controlled by AI, to actually get to their very destination. So those two areas, and the telemedicine as well. If telemedicine is expensive, but if we have areas where we can actually move medical doctor or medical expert, we can actually use telemedicine in those rural areas, so doctors can communicate from a long distance and still pass their message. So I think we're need to look into conversational AI as a tool. It's a very good one. We have almost everyone in Africa, at least the youth have smartphones, so we can use, medical expert can reach them through this chatbot. Chatbot having humans in the loop. So yeah, that's very good example for us. I think that will help a lot. So yeah, that's it.
All right, thank you, Alan.
I want to add just 2 sentences. I totally agree with what was said, but just to say, for me, it would be great now that almost everybody has a smartphone, to have a few apps who are created really for health and who are common. That's one of the big problems at the moment. There are many health apps, but nothing used by enough people, and nothing that we can share enough. That's it.
Thank you so much, Didier. Okay, so we'll go to the next question. All right. Can you share experiences of using AI to predict disease trend and allocate resources accordingly? Can you share experiences of using AI to predict disease trends and allocate resources accordingly?
Just to say that for me, it's also for a big part the same answer than before. If there was an application that, let's say, a big number of people would use, after that you could have the signals and you could analyze easier. This is for me very strange that it still doesn't exist, and especially it still doesn't exist, but that's more a problem in Europe than in Africa, but for all people. That's it.
Okay. Can anyone hear me?
Hello.
Yes,
we can. Yes, we can.
Yes.
Okay.
Yeah. So please, Ifeoma, please, 1 minute.
Yes.
Okay.
Yeah, I just want to suggest, can you just like share the questions in the chat? After the next question, you may just like share many questions in the chat, then people can respond to those questions. So everybody can still see what's going on in the chat because of time. Because
Okay.
the time we are, yeah. Thank you very much.
Okay. All right. Thank you. Okay. So we're taking the last question before I share it. Okay. So we're taking the last question before I share it on the chat. So the last question now is, what are the cultural and social factors that can be considered in AI-based public health intervention in Africa? What are the cultural and social factors that can be considered in AI-based public health interventions in Africa?
If I may quickly, so I think some of the things that needs to be taken into consideration when we build this, we tend to build technology to cater for the people that already have the advantage. And we don't consider the people that are previously disadvantaged. I'm talking about people that are living with disabilities. I mean, if you're thinking, for example, about people that are deaf, those people are subjected to having to go to doctors. And, they need, in most cases in Africa, to have somebody there who understands sign language to explain to the doctor what their problem is. Imagine a mother who only has sons, and those are the only people that understand what she is saying. When she goes to the hospital, say for example, she's got
Caroline from
she has issues related to I'm gonna be cultural and tell women-related issues. That's what I'm gonna say. Now, the son has to sit there and have her mother explaining to the doctor there is something wrong with her private parts. It can be very embarrassing, and it goes across all the cultural norms in Africa. So I think when we're building this AI, we need to also take into consideration that we have people like that in our societies. We have people that understand some of the languages that are being used. So in South Africa, we've got 12 official languages. We have now just, the 12th one is sign language. But to this day, well, it is new. It was added early this year. But we've had people that are signing forever. But one thing that I don't see being done with speech and incorporated in is build AI that will understand when I am signing in the sign language that is in Africa that is different to the sign language in Zambia or in Nigeria, so that the doctor understands, so that the person is not embarrassed or disgraced when they have to, so that they are not, they don't think twice when they are sick, because sometimes people don't go to the doctor, not because they can't go to the doctor. They are thinking about what it takes from when I leave my house, when I get there, what I need to say, and what will happen when I come back. The embarrassment that comes with this. So we need to just bear in mind. There's somebody in South Africa who came up with a glove because he had issues like that translate sign language into written language, so that the mother can put the glove on and be able to sign, and this thing, give the text to the doctor so the doctor understands what's happening. So things like that, we need to use AI to improve and advance and ensure that they are available in the different languages. And I'm just using, people that cannot hear as an example of the many disabilities that we have that we do not cater for, the many disadvantaged people that we have that we do not cater for in terms of our healthcare system.
Thank you so much. Thank you so much, Brenda. Okay, so thank you, everyone. Thank you for all the panelists for the amazing questions. I'm a data analyst, but of course on entry level, so I have really learned a whole lot. I've learned a whole lot, and thank you for giving me the hunger to want to study more, do more in my career. Thank you so much. Okay, so the next we'll be going for the question and answer session now, and so I want you, if anyone has a question, the person can just drop it on the chat. Then I'll read it out and have, now this is a general question. It's not just for the panelists, yes. So this question will be thrown to the house. So if anyone has an answer to it, the person can answer. And so you can start sending in your questions so that we can answer them. Thank you.
Hi, hello. Hello.
Yes.
All right. So my question is directed at you, please. So you said you've learned a lot as a data analyst, data scientist, entry level. So thing that you learned from the perspective of an entry level data scientist or data analyst. Thank you.
Okay, sorry, I didn't get the question. I should say what I have learned exactly.
Yeah. So you said you have learned.
Okay.
As no, but I'm trying to emphasize an aspect of it. I understand that have different people with different backgrounds and all. So, what is that one main thing you learned as an entry level data scientist?
Okay, I get the question. Now, when I first started my career, of course, we were first advised to create a niche for ourselves, not just analyzing any data, but picking a particular data and working with it and running with it. And so I actually picked a data in agriculture, yeah. But I think this discussion is based on public health. Yeah, and from everything I've learned, it just shows that there's still a whole lot of work to be done in Africa. Yes, there's still a whole lot of awareness to be done in Africa. And the most important thing is, how do we leverage data? How do we use data to our advantage? Because I've come to realize that we Africans, we have lots of data, but we do not know what to do with it. Okay, I'm currently serving, and I'm serving in GED. Now, GED is just electricity distribution company that distributes electricity to Jos in particular. And I've come to realize that we have lots of data, but we don't know what to do with it. Yes, so I think this is an eye-opener to actually show that we have a whole lot of work to do in Africa. And then as Africans, we need to open up our minds to technology. I don't think we've actually opened our minds to technology. It seems like we've opened our minds to technology, but we have not. I think it was Dr. Ebere that said something like people being skeptical about sharing their information. Now, I want to work on data sets on health, but how are people susceptible? Or should I just say, how do people accept? Are people willing to even give out their data for us to be able to work with it? And that's actually what I've learned. And so in my own end, I think sometimes I find it difficult, or I feel reluctant sharing some certain data, yes, online, but this has actually shown that there's really nothing wrong with it. It will just really help with problem solving and all. Thank you. Sorry, so do we have any more?
Yeah.
Okay.
Go ahead. I was just going to say that somebody forget. Yeah, go ahead. Sorry.
Okay. No, I'm done. Thank you.
So Agbolat, you are muted at the moment. Probably you are speaking, but muted.
Okay, so can we move to the next section? I have noted some questions during those discussions, so I will bring those questions up later. All right. So, but in keeping to time, so Ifeoma, can you just introduce our first guest speaker, please? Thank you.
Okay, so our first speaker is Mr. Sorry if I don't pronounce your name so well, but please just bear with me. Okay, so our first speaker will be Mr. Otse Ogoro. And please, you have 20 minutes to speak. Thank you. It's Mr. Otse.
Yes, I'm here. So good evening, everyone. I'm trying to load my slides.
Okay, thank you.
So while I load my slide, I just want to say that it has been really an interesting conversation, and like Ifoma has said, I've learned a lot, but there's still more to be learned as we progress. So I'll be speaking on the topic data science for disease surveillance in African and early detection in African communities. Please confirm you can see my slide.
We can see your slide.
Great. So as a background, my name is Otse Ogoro. I'm the country director for DataFi. DataFi is Data for Implementation. It's a USAID funded project.
What?
Can you hear me?
Where would you?
Yes, we can.
Okay, I'm getting feedback. Okay, like I was saying, DataFi is a USAID funded project that deals with data and electronic solutions for the health sector. The project is a 5-year project. We are in the 4th year of the project now. And, like I said, I'll be speaking on this topic. So, as part of the introduction, I want us to have an understanding of the challenge. So to begin, let's recognize the unique challenges that African communities face in terms of disease surveillance and early detection. Africa is vast, it's diverse, with different cultures, with different traditions, and different healthcare infrastructures. This diversity is both a strength, like I would see it, and also a challenge when it comes to health management. The factors such as limited access to healthcare, resource constraints, and emerging infectious disease presents formidable hurdles that we as Africans need to cross. When I listened to the discussion I was before my presentation, there were a lot of discussion about resource constraints, about the challenges that prevail in Africa. Data fragmentation is also one of those challenges that we currently experience in Africa. So what are the definition of the terms that we'll be looking at today? Like I said, I'll be speaking on disease surveillance and also talking about how data science.
Otse, sorry to interrupt you. Can you speak louder or closer from your mic, please? Because people
All right.
have
How about now? How is it? Okay, great. Sorry about that. So like I said, I'll be speaking on just define some terms about disease surveillance and also define data science. So disease surveillance basically is an information-based activity that involves collation, analysis, and interpretation of large volumes of data. And these volumes of data originate from different sources. It's important that this is one of the things that data science is able to help us do and do quickly. Ability to actually analyze large volumes of data from different sources. And as you see from the definition of data science, it's a multidisciplinary approach that encompasses the fields of mathematics, statistics, artificial intelligence, and computer engineering. I shouldn't be defining this because everybody here they're versed in this area. Machine learning as one of the branches of data science can be used to identify patterns and trends in the data. It can also help us to classify cases and symptoms, to predict the risk of outbreaks, and to evaluate the impact of interventions. In Nigeria, where I currently work, there are a couple of data machine learning algorithms that will be introduced into our electronic health records that is helping us to predict the possibility of someone testing HIV positive, as it were. We can also use artificial intelligence to generate natural language summaries and visualization of data to facilitate communication and also to help us disseminate information. So now we're going to be looking at the power of data science. One of the power of data science here is some predictive analysis. I spoke to it earlier. Data science allows us to build predictive models that can forecast disease outbreaks and trends. Machine learning algorithms, like I spoke earlier, can also help us to analyze historical data to identify early warning signs and provide vital time for interventions. Like I said, we have this algorithm that we've trained in our system. We'll soon scale it out. We'll train it in a system that is able to predict to between 60 to 70% accuracy someone that will test HIV positive, and it can run in less than 20 seconds. You get the details. Predictive analytics leverages historical data to identify patterns, like I said, and make predictions about future events. Moving quickly, I'm cognizant of my time. We also have to look at the aspect of real-time monitoring. Real-time monitoring, that is the use of data science, which data science enables us to actually monitor our cases real-time. And with the proliferation of mobile technology in Africa, we can capture health information from remote areas and enable swift responses to health emergencies. I once engaged one project that used text messages to send information upward, and this you are able to gather information from the remotest part of the community, African communities. The elections in Nigeria, the last election in Nigeria, have shown that a lot of people are now becoming tech savvy, understanding the use of mobile technology, and with the proliferation of smartphones across our communities, it's easy to use this, to leverage on this opportunity to actually report disease outbreaks, disease trends, and allow systems to actually analyze and help us make decisions. Big data integration. Data science offers the potential to integrate diverse data sets. This helps in harmonizing fragmented health data, thereby improving the accuracy and completeness of disease surveillance efforts. AI, as we all know, has the potential to actually revolutionize our healthcare. AI-powered algorithms can analyze vast amounts of data. It can identify patterns and assist in diagnosing diseases accurately and swiftly. Additionally, machine learning algorithms can be trained to predict treatment outcomes, recommend personalized treatment plans, and improve patient monitoring. Integrating AI and machine learning technologies into African healthcare system will actually lead to more precise diagnosis, personalized treatment, and improved patient outcome. The whole thing here, the whole goal that we all chase is to improve patient outcomes, as it were. Now, the question is, what is the African context? We have seen the power of data science, but how can we make this power of data science become operational in the African context? There are a couple of challenges that we must understand that we have, and then we'll have to decide on how do we best position ourselves to overcome these challenges and make the power of data science work for us. Sorry, is my video on? I don't know.
Yes, your slides are visible.
Okay, fine. So resource constraints is one of the challenges that we have in Africa. Many African countries struggle with limited resources for healthcare. Most of our programs are donor funded. Most of our activities, if the donors are not available, it just crumbles and it doesn't move forward. Now, with all these, with the challenges in our healthcare system, what are the opportunities that are there? Number one, we have to engage country governments to ensure that to create buy-ins to ensure that they have sustainable domestic resourcing for our systems. If not, this is not going to happen. We also have to leverage on existing funds. These are the low-hanging fruits. We have a couple of donors in country. We have PEPFAR in most African countries. We have the World Bank credit. We have internal generated revenue that can actually be channeled to data science to improve the health outcomes of people. One of the things that one of the priority agenda of the new Minister of Health for Nigeria is patient outcomes. And I was particularly happy when I heard that heard that as part of his agenda. Going forward, another challenge for Africa is our infrastructure. Our infrastructures are weak, they are outdated, most parts we lack infrastructure. Connectivity is also an issue. One of the concerns I had here was, I hope that my internet connectivity will work fine and well. I'm glad it's working so good so far. It's one of the challenges that we have in Africa, and the opportunity here is that investment needs to be made in improving infrastructure and expanding internet access, particularly in rural areas. We can work with the telecom companies, the private sector, the donor companies that are interested in this area, and then they can invest in improving our infrastructure and our internet connectivity. Emerging infectious diseases in Africa has been one of the challenges that have confronted Africa. Africa has been a hotspot for Ebola, there was Zika, and a couple of other. There's monkeypox now that is making the rounds, and there is a need for rapid response and early detection, which is crucial to ensure that we contain these diseases and we make the appropriate decisions about these diseases. If we're able to harness the power of data science, we're able to, like I said earlier, identify areas, how disease spread, the patterns of disease spread, the communities or the populations that are most vulnerable, the populations that are most affected by these diseases, and then we're able to provide solutions as timely as possible. Data fragmentation is one of the other challenges we have in Africa. Our data systems are often fragmented, and the donor funding has not made it any better. So you have the Global Fund funding AIDS, tuberculosis, and malaria. Then you have PEPFAR funding HIV and some form of tuberculosis. And we are talking about the same patient, and this patient have data in a malaria system, and in a HIV system, and in a tuberculosis system. These systems are not speaking to themselves. We can leverage existing e-health system in the health sector to actually see how we can harmonize this system. An African government must take the bold step to lead this in the countries, because most times we see that when the donor funding come, they do not decide what happens in most African countries. But if the African government will actually put their foot down and lead the charge in their countries, we'll be able to start looking at, again, harmonizing and integrating some of these health systems there's multiplicity of health systems in the health sector, different tools that are being used. I know Ethiopia recently started looking at streamlining and integrating most of their digital e-health tools, because they had a lot of them in the system and it was causing chaos in the system. There is a need for proper and adequate data governance, which is key to ensuring that we have better patient outcomes and we have good and quality data that we can use to make decisions. Now, so implementing data science in the African context, what do we need to do? Number one, there is a dearth of capacity. We need to invest in training of healthcare professionals and data scientists in the African communities. One of the things that we're looking at doing in Nigeria now is to see how we can build the capacity of our healthcare professionals in the Ministry of Health, to have an existing pool of professionals that will be working on big data, to have the big data capacity in the Ministry of Health, be able to interact with these tools and make decisions. They don't have to wait.
Sorry, Mr. Otsi. Sorry for interrupting you. You have 5 minutes. I'm sorry. Thank you for the interesting session.
Thank you so much. I'll just try to rush through my slides now. Like capacity building is key, like I said. Data sharing and collaboration is key. We have, like I said, under the Ministry of Health, we have an HIV/AIDS program, we have a TB program, we have a malaria program. These programs don't interact with themselves, they don't interact, they collaborate. They have different systems, but they manage the same information for the same client. And it's important that data sharing is put as an agenda for government, and collaboration is key across the multi-sector that we have in Nigeria. Ethical consideration. It is crucial that data science is used ethically. We must respect privacy and data security. Additionally, we must ensure that vulnerable populations are not further marginalized through data collection or data analysis. Moving quickly, we must engage the community that we work with. The community, they have to participate actively in data collection and disease surveillance, which is key. And then local knowledge and grassroots involvement can provide valuable insight for early detection. In conclusion, I want to say that data science is not a magic bullet that can solve all our problems. Like when I heard the questions that were coming out, I knew that we should not have this thinking that data science is able to solve all the problems in the health sector. There are many challenges, there are many limitations. We have challenges with data quality, privacy, security, ethics, data governance, interoperability, sustainability. Also, the human factor is also one of the things that we should also consider. In conclusion, data science is a powerful tool that can help us enhance our disease surveillance and early detection in Africa. It can help us collect more data from more sources in real time, analyze more data using more techniques and models, and integrate more data into more decision-making process. When we do this, we're able to improve patient outcomes. So I want to say thank you very much to the team for this session. Over to you.
Thank you so much. Data science is a powerful tool that cannot just help us in the health sector. It can help in every area of our lives. Sorry, I'll just share something little. I can remember when I first started, I was playing around with data. And before I got married, I was dating my husband and then. So I just entered some our call logs, yeah. I just wanted to know who, it's not like as if I didn't know. I just wanted to play around with it. I wanted to know who calls more. And I wanted to know at what time of the day do we make more calls. And it was actually really beautiful. I shared it with my husband and he was really impressed. And I realized he actually calls more, yeah. And we talk more at 6 p.m., 7 p.m. thereabouts. And it actually helps because at that point, we know that, okay, at 6, 7, we know this is our time. You know, this is the time for us to talk. And so we know that once it's 6, 7, we just round off with whatever it is we're working with to make our time for each other. So, and that's just a little we can do with data. Data is amazing. Data is life. That's what I say. Data is actually life. Thank you so much, Mr. Utse, for this amazing session. And so we'll move to the next session, to the next speaker, Dr. Ebere Azuma. And you have 20 minutes. Thank you.
All right, thank you so much. Let's get started and I'll be respectful of time. I'm going to share my screen shortly. All right. I'm almost ready.
Okay, we can see it. Thanks.
Can you see it? All right, very good. So, I apologize if this is very elementary. I wasn't sure of the audience, but it's okay. Sometimes we have to define words and bring definition. Mr. Ogori, your presentation was excellent. So I thank you for that. Okay, so what's the impact of artificial intelligence in public health? I wanted to define what artificial intelligence means to me. Something as one thing about being a physician and an educator, a community educator, is after I learned the big scientific way of defining things, I always come back to make it palatable for the community I serve. So pardon me if I don't sound too, scientific or intelligent. It's just I'm very community focused. So when I think of artificial intelligence, it's basically the use of technology and or machine to emulate human intelligence. That's basically what it is, right? So that's basically what it is. But the difference between human intelligence and artificial intelligence is it minimizes human error, considering the biases that could be in it, but it does minimize human error. Okay, let's go to the next one. Okay. Pardon me. All right. So when you think of human intelligence, at least for me, the thing about human and humanity is we have the ability to understand language, we learn, we adapt, and we solve problems. So basically, artificial intelligence allows us to do just that. Right. Okay, so we've seen the role of artificial intelligence in many spheres of our lives or sectors. It includes like social media. I like social media because I would say the success of my organization I co-founded and I run it currently. Love Your Menses is our work in our social media. So Love Your Menses is an organization that creates menstrual equity in the United States and globally. We first started in Boston, and now we're in 7 other countries. I'll list the countries for respect of the people we work with. So we're currently in Nigeria, we're currently in Haiti, we're currently in Sao Tome, we're currently in Uganda, we're currently in Liberia, we're currently in Kenya, we're currently in Uganda, and people want us to expand, but again, we have the human capacity, so we cannot expand at this time. But how did we grow? We grew through social media, through reporting or talking about period poverty. We started in 2019, and I have to humbly say that in Massachusetts, they just passed the IAM bill in the Senate. The IAM bill basically will be providing period products in public spaces in Massachusetts. So to me, it's a big victory because when we first started the work, it was not a thing, but with our persistent collaboration with other policymakers, we were able to influence policy. So social media does help in changing behavior. So like I said, Facebook uses AI to understand and gain knowledge about their users, deep learning, for example, deep learning to create targeted ads. Similarly, we've used Facebook to talk about period poverty. We've used Facebook to change people's mindsets. Now we have people talking about loving their menses. It's counterintuitive because some people, especially people that identify themselves as women, some of them do not love their menses. So it's just a plain word, basically manifesting positivity by loving what some people don't like. And then we also see artificial intelligence in social media, Instagram, when you search for one image, it populates similar images to help you find things. So it's so amazing. I love social media. Again, the success of my organization is from social media. Artificial intelligence is here to stay, and we have to be ready to continue to use it in public health and in medicine. Mr. Ogori basically talked about the limitation, talks about the application, and earlier on we had this robust and beautiful discussion on ways to use it. Okay. All right. So there are different types of artificial intelligence, and for public health and medicine, we can see the machine learning. We can see all of that. We can see the robotics. So today I'll just focus on machine learning and robotics. Earlier on, we had the question of how has artificial intelligence improved healthcare in Africa. I would suggest at least maybe not just Africa. One second. Maybe not just Africa, but just globally, the impact of robotic surgery. We see that some surgeries, for example, I think prostatectomy is done 3 out of 4 are done using the robotics equipment. And we are seeing that even in the military, at least US military, you can even be far away from the robotic device and help assist in surgeries. It will be really, really great one day when we have that capability or capacity to do it in remote areas in Africa. It would be really, really cool to, for example, save a woman from having a postpartum hemorrhage by either, after the medicine has failed, like using the robotics remotely to do a hysterectomy. It would definitely provide more access to care. Again, we talked earlier on about human error. We see human error is an epidemic in medicine. Johns Hopkins data in, I think, 2016 talks about human errors in medicine being number 3 cause of death, at least in the United States. Talk more of in Africa, talk more of in Nigeria, talk more of in just whereby we see people are misdiagnosed because of human error. People are misdiagnosed because of lack of access. I'll give you a personal story. My dad lived in Jos, and he went to church and he was having a headache and not feeling well. They took him to the hospital. His blood pressure was really high. No one attended to him for hours. By the time they attended to him, he has now stroked out. That was definitely a preventable stroke, right? And he ended up dying. I think to me it's prematurely, because if it was in the United States, they would have stratified him accurately and controlled his blood pressure, and he would be alive. So there's work, as Mr. Ogori says, even though there's work to be done, there's hope that all of us can eventually make a difference. All right. So when I think of public health, yes, I talked about medicine and surgery, but let's redefine public health, right? It's the study and practice of protecting and improving the health of people and the communities through disease prevention, research, education, and promotion of healthy lifestyle. So to me, surgery and medicine are a part of public health. Yes, I know there seems to be a dichotomy between people that talk about public health and medicine, but those of us that do both, we see that they are interconnected and interrelated. So when I say medicine, to me, it is public health, just a subset of public health. All right, so we talked about earlier on the biases, and I stated the example, and Brenda also chimed in, I believe it was Brenda, where we talked about like the data algorithm, that it has to be Afrocentric. It has to focus on Africa and take into consideration their cultural norms and the religious aspect. So that's very important. All right, we all know that AI is here to stay and is going to help us perform better and keep patients and our population safe. I love what the CEO of Google says, Sundar Pichai. AI has the potential to improve billions of lives, and the biggest risk may be failing to do so. So we have a good tool, is here to stay. We Africans, we have to work to utilize it and take advantage of it without having casualties. Thank you, Dr. Azuma.
Thank you so much. Thank you so much, Dr. Ebere. Thank you. Thank you. Okay, so our next speaker is supposed to be Dr. Leslie, but she won't be available because she had an emergency, a medical emergency, and so we'll just have another question and answer session. So if you have any question, you can ask or post on the group, and we'll throw it out to the we'll throw it out for anyone to answer. Thank you. It's question time. Any question at all related to our topic? Any question, even not our topic, any question related to data science? Related to data, any question? Okay, so in the absence of any question, we'll just move to the next speaker. And so the next speaker will be Mr. Nell. Yes, and you have 20 minutes to speak. Nell, you're
Thank
next.
you. Thank you.
You.
Appreciate it. All right, let me just share. Sorry, is someone asking a question?
No, I think it was only kind of a problem with the sound of somebody. You can continue.
All right. Well, thank you, everybody. Wonderful to be here. Fantastic conversation. I know we're just scratching the surface, so to speak, on everything that's going on. But I'm grateful for the opportunity to share a little bit about how AI is actually kind of evolving and helping to advance medicine and healthcare. And I thought I'd start by going back 10 years. So back in my days, being part of the original IBM Watson team. And after we did the Jeopardy Challenge, which is a game show in the US, we were asked, look, you spent a lot of money, you spent 6 years working on this, what's next? And we thought about it and said, it makes sense to take this into healthcare as the kind of the first industry, because there's a lot of need. And about 10 years ago, there was a woman in Japan who fell ill, saw her doctor like 20 plus years, couldn't quite figure out what was wrong with her, started bringing some specialists in, they ran tests. Long story short, after 7 months, they weren't sure what was wrong with her. So one of the doctors reached out to us and said, could Watson do something to help? We're like, well, we're not sure, but let's see. So Watson looked at all the great work the doctors did, the medical results, analyzed the patient's genomic structure, the family medical history, her history, asked the patient a few questions, and came back and said, I think she's got these 2 rare forms of leukemia. And so it was surprising, never seen something like that before. Doctors were a little skeptical, but Watson said, these are the reasons why I think. So they tested her. She tested positive for both forms. So thankfully, none of it was wrong to at least put her on a treatment plan. A lot of people started asking the question, how was Watson actually able to do this when these great doctors couldn't? And the advantage that Watson really had was it had read over 20 million medical treatment studies at that point. There's no human physician that can actually do that. If you just started reading nonstop, it would take you over 300 years to read all these medical studies. And that's really the advantage that AI gives us. The fuel for AI is data. And that's why you always hear this expression that data is the new oil, because we're generating so much data. We generate over 9 petabytes of data per day, which is more than all the books and all the libraries combined across the world. We're essentially data factories, and we're actually creating so much data today that's really more for machine consumption than human consumption. You think of like IoT, Internet of Things, sensor devices. There's 31 IoT devices are added every minute just in Africa. So what are we doing with all this data? Well, we've had some great discussions so far about some of the things, even with the infrastructure and the funding and the resources that are currently available within Africa. Luckily, there are some really good things that could actually be done and have been done, particularly with chatbots. That was the first forays with healthcare. And so you look at things like Akita, which helps do appointment scheduling. You look at like Ada, which is helping with triage and management systems. You got Siri Health education. You got Help Mom, which is helping keep track of vaccination and providing assistance information for infant care. You got the United Nations lab in Nairobi working with the nonprofit Intellios to help with ultrasound and maternity care. So there's actually a lot of work already going on, and I know it's just a kind of a first step, but it's a big first step to actually start creating the ecosystem and showing the value we're getting from the technology within healthcare. Now, that being said, we actually have a big challenge when it comes to using AI. And that's because we're used to computers being about automation, that we're doing something faster or cheaper or less errors. And there's nothing wrong with that. We're only tapping about 20 to 30% of the value from AI. It's got whole new sets of capabilities that we're not used to. That sorry, is there an issue?
Can someone please unmute everybody?
Thank you. So we're used to
I'm
automation.
sorry, I had problems to find who was speaking. So yeah, go ahead.
It's all right. It's all right. Thank you for that. So because of that, we're not tapping a lot of the new capabilities, which we want to think about innovation, which is really trying to find a new way of performing the work. Right? We have our traditional tools in our toolkit from technology, you know, a screwdriver, a hammer, a wrench. And now we have like this widget thing we've never seen before. We have to learn the capabilities to be able to actually employ that. Now, I know innovation is a word that gets thrown out a lot. So I'm going to play a short video on some work that we're doing right now. There's not much audio, so don't worry about that, but just watch what this gentleman is doing.
Cool. You want to do some research? Sure.
So you probably noticed that somehow he's controlling that with his mind, and he kind of is. You know, technologists, our first reaction is great, drill a hole in his skull, put a chip in, and decode his brainwaves using AI. Well, AI can only do what we've taught it to do. We don't actually understand the brain well enough to do that. And this is really one of the key differences when it comes to AI and traditional software, is that you need the domain knowledge. So we actually work with doctors and clinical researchers. What they actually help us understand is that while the brain can still send a signal to a phantom hand, it actually triggers a process in the body. It's not just brain to hand. And part of that process is muscle and tendon motion. So if you look above the right elbow, you see this black band. It's an IoT sensor array designed to actually capture that motion. That we can teach to an AI system. So as you've seen, he's able to raise his hand, make a fist, get high five, shake hands. He can actually hold coffee and drink from it. So there's a level of mobility that's actually been restored here, but we found a different way of doing this than just trying to automate the traditional process. And we could have only done this with the expertise of these doctors. And this is actually how AI really works. The best AI solutions in any industry, particularly healthcare, really come from the people on the ground. They come from nurses, physicians, assistants, all these folks, clinical researchers, because they understand medicine, healthcare, how the body works, and some of the things around, what triggers what. And that's really the key thing, because I know a lot of people come in saying like, okay, there's a lot of smart technologists, there's a lot of big tech companies. They'll start building, applications and tools for us to use. The truth is they just don't have that kind of knowledge to help you. I mean, no offense, I wouldn't trust Mark Zuckerberg to do open heart surgery on me. What does he really know about that? That's where we have to be cautious, because everyone thinks AI is a lot of coding. It's not. It's very little coding. It's really more about the data and some experimentation. And that's been a common theme, I think, throughout this entire event. We heard in the panel, we heard from the few speakers before, the importance of actually having data. And that's really how AI works. We don't program it, teach it. But if we can do that, we can do some amazing things. And we're already starting to see things like You have our traditional, demographics like age, gender, location, job title, but we've actually been able to teach AI psychology. So because of that, it can actually analyze things from as little 100 words and decipher you across the 56 personality traits. It can actually infer what your hobbies and interests are, what your opinions and attitudes might be. So even the level of commitment you might have to your treatment program and we follow through on it. You marry that with another science called neurolinguistics, which is the study of language. Language is really like a fingerprint. This is actual output from an AI system analyzing from a meeting. These guys were nice enough to share it. But you can see whatever they're talking about, the level of commitment that they have, the way that they learn. Are they visual learners? Data? What is their interest? How to actually follow them? They'll even coach you on what words to use to help them understand and make some of these ideas actually resonate with them. So what can we actually do with this? Well, now we know how to speak each person's language, using the preferred channels, offering the right incentives to maximize patient engagement each time, every time. Thanks to these AI tools, doctors have been able to better explain what's going on with the patient and the importance of their treatment plan, to actually assess what's the likelihood that they'll stick to this type of treatment plan, to improve bedside manner, and actually improve overall quality of care. Rifle this over into mental health. At least before the COVID pandemic, loneliness was actually the biggest illness in the world. We now have tools to actually help people that if you do feel lonely, that they feel isolated, and not as a substitute for human engagement, to help create a safe space. If they have an episode in the middle of the night, some resource they can tap into. It's a tool for therapists and psychologists to help them out. Bring it on, bring it from me. Are they really suicidal? Are they going to unfortunately maybe kill themselves? They didn't really. We're also seeing more use of like ultrasound, giving them the infrastructure in Africa that this is actually could be a much better way to do some disease detection without having to rely on like MRI machines. And so organizations like the United Nations and Intellios are actively trying to teach and implement these tools. They're using AI so that you don't necessarily need to have the equipment in front of you. They can teach you through, your screen, haptics, those types of things, as well as start building a data set specifically on the various regional African populations. So this resonates and it actually has more value. In fact, one of the things that's actually happening right now with AI is the use of synthetic data, which is fake data that looks like real data, because often we don't have enough data to teach the machine. But now we're starting to see this with synthetic imaging. So we can actually build up data sets much, much faster so that we can accelerate quality of care. And then drugs, pharmaceuticals, it's being used across the board. Ironically, thanks to some of this, data science and analytics, it's now believed that 1/3 of drugs may have been prematurely abandoned because of poor patient candidate selection, or it might have been more of a localized population that would actually benefit from that. And obviously there's lots of diseases, some a little bit rarer, some again regional. There's a lot of tools that are actually getting built to kind of commoditize this, so you don't need specialized equipment. You can also accelerate molecule development and drug discovery. So I'm going to play another quick little video right here. This is an overview of something called Pernicious AI. They have a Lyme tool that they make available for the average researcher anywhere in the world to help them actually do drug discovery.
With Lyme drug design, users can simply provide the protein structure and site of interest for any therapeutic target and harness the full power of AI at their fingertips. With only 2 clicks, the software will automatically design fully novel drug candidates specifically optimized to bind to the target site for synthetic efficiency and several other drug attributes. For more advanced users, design goals can be fully customized to prioritize any drug attribute to meet your project's needs. After clicking Design Novel Drug Candidates, the software will automatically task thousands of computers on your project, designing drug candidates fully autonomously to save practitioners from the tedious work of hit identification and lead optimization. Within 3 days, the drug candidates will be ready to view, with results from molecular dynamics simulations, cheminformatics screening, advanced AI predictions, and many of the softwares you're already using today. Additionally, each molecule comes with a 3D visualization of both the drug and its predicted binding modes, along with pre-computed synthetic routes using only commercially available materials. For drug repurposing, users can upload any number of their own molecules using the screen option. By providing the drugs in SMILE format, they'll be automatically screened and added to the view page.
So again, you can see the ability to help commoditize some of this work through AI so that we can actually do things with less resources and hopefully faster. Now, we've heard a lot of challenges. I don't want to mislead anyone. There's a lot of power here, but you got to have enough data. So you've all heard. You need the subject matter experts. And this is one area a lot of people stumble around on, unfortunately, because like I said, AI is not programmed, it's trained. So you need the subject matter experts available to teach the machine. And that's why your training strategy becomes very critical. You have to think about things like, unfortunately, bias, as we heard during the panel. So the worst thing is really implicit bias, which is why we really need, people that are in the populations or people providing the actual quality of care in a localized area to be involved in that level of training. Otherwise, we're not going to have the proper diversity in our training sets to actually help that population out. So there's obviously a lot of things have been done around the world. There are some great things happening right now in Africa, but there's opportunity for all of us, right? Across the board, from the patient side all the way to the physician side, there are opportunities for us to actually do more with these tool sets to actually help more people, improve quality of care, make healthcare more accessible and affordable for general populations. I ask of you, do not wait for other people or tech companies trying to figure this out. I think each of you know something or experience a pain point. Learn a little bit about these AI capabilities and see what you might be able to do to be a driver of these changes rather than just a passenger. So that's kind of my homework assignment for all of you. So I like this quote from Peter Drucker: the best way to predict the future is to create it. That's the opportunity we have with AI in healthcare right now. Each one of us can help create that future that we want. With that, I thank everyone for your time, and I hope this was helpful. And I think we have time for Q&A scheduled in the agenda, so I'll back out for a moment.
Thank you so much, Neil. Thank you. Thank you for that amazing session. Thank you. Okay, and so Neil is our last speaker for the night, and we'll be having another Q&A session. Okay, so do we have questions for any of the speakers?
Hello.
Okay.
So, yeah, so please, can you allow Didier to talk? He's raising his hand. And
okay.
I have some questions for some of the past speakers and panelists. So I'll be dropping that in the chat, but I think Didier's hand is up. So I'd like us to attend to him first. Thank you.
Okay, please. Didier.
Yes,
okay.
Yes, thank you. This was quite interesting. The two speakers, the two last speakers, I had actually the same similar question for both of you. What you are doing, proposing, is that something, let's say, in a kind of a commercial organization, or it is a not-for-profit organization? Thank you.
All right. Okay. I can see. Thank you, Didier. I think I can see someone's hands up. Jaming. Jaming, I think I can see your hand up. can ask your question. Okay. 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 Jamin, can you hear me?
Okay, thank you very much for the presentation. Please, I just
You are muted, Jamin.
Jamin, I think you're muted.
I just wanted to, or you to see you being trained.
Hi, Jamin, we can't hear you. We can't hear you.
Probably network issues. What I was saying is that I was appreciating Nell for the presentation, and I was just highlighting that in the course of his presentation, he did make mention of the fact that AI tools are not being programmed; they are being trained. So I was just pleading that he throw more light as far as that is concerned. Thank you. I don't know if you got me this time around.
Okay, I think I heard you. The question is for Nell. Nell, did you hear his question? And I think you should answer if you did. If you didn't, I think you may have to recap.
So I think he was just saying thank you, and he was pointing out that my point that we don't really program AI, that we actually train it, was actually helpful for him to understand how this works. So that's the way, at least what I heard. If I'm mistaken, please feel free to correct me.
Okay,
yes,
I think
you got it right.
Okay. Okay. All right. Do we have any more questions?
Hi. So please very quickly, yeah, Didier just asked a question, and I think that question is for probably Neil and Dr. Azuma, I guess, if it is for the last two speakers. So Didier, please, can you repeat the question so that Neil and Dr. Azuma can answer that before we go to next questions? I have my own question, but I just want to be sure that we are telling questions one after the other, please.
So no, it was not really for the two first speakers, because it was for the two last, because they were showing I would say project, and I was asking, is that with a commercial goal or not, NGO goal, and one of the speakers answered online in the chat, so it's okay, I think. Thank you.
Okay, thank you, Didier. I think, okay, sorry, before you go, I think there's a question.
Just, sorry, maybe Peter Drucker, you can say, answer to the question. Just, is your project kind of commercial, or is it non-for-profit, not for profit, sorry.
Well,
okay.
Yeah, I think we should just, so before I can just go on. I think Dr. Neil already answered. So if Dr. Azuma can hear us, then he would answer us. But otherwise, we just have to continue because of time. So
Okay.
we can just put the question in the chat, please. Thank you. Okay,
so let me read this question in the chat, and I think it's quite interesting. It's quite an interesting question. He said, the question is from Julia. It says, are there any success stories for the use of AI to improve the access to healthcare for persons with disabilities? Are there any success stories of the use of AI to improve the access to healthcare for persons with disabilities? So anyone can answer.
I mean, I'll go first. There's two examples that I'll share. So one, something called Seeing AI that was done in partnership with a nonprofit and Microsoft. And so you can actually use your mobile device, like your mobile phone. And if you're vision impaired, the camera will actually look and the AI will actually describe what it sees. So for people that are maybe going around an area they're not familiar, or there's signs that they're not aware of and obviously can't read, it's actually been helpful, especially if you went into a new hospital system you've never been to before and you're trying to find a particular area or physician. It's been helpful in actually helping them connect with that. The other one is, and this is actually right now only in Korea, but they've created a tool so that if there's a verbal alert, like you're at a metro station and something's happened or there's a fire, they blast out audio messages. If you're hearing impaired, may be unaware of that or be unaware of the directions they're providing. And so what they've done is for these alert systems incorporated AI so that you have this, again, app on your mobile phone that if one of these alerts gets triggered, the app will actually capture that and send you text messages explaining what the audio alert is actually saying. It might provide maps, other things if like an evacuation is necessary. So that's something they're doing to help the people that are actually audio or hearing impaired.
Oh, thank you so much, Neil. Thank you for that, for the answer. Okay. So are there any more questions? Are there more questions? Okay, so I have a question in the chat and it's addressed to Dr. Neil. Okay, the question says, AI is more about training, not programming. Can you talk about the problems of bias in training data and how to reduce the bias? To Dr. Neil.
Yeah, I wish I had 2 hours to go through that. It's a complicated subject. The truth is that all data is biased. We know that. It's not the explicit, obvious biases that we have to worry about. It's the implicit ones we call unconscious bias that kind of, we make associations with a certain neighborhood or certain type of job or, certain population sets, and that we don't really realize that. Give you an example of that's not in healthcare. The United Nations is actually very big champions of having AI robot judges. They believe that will improve, timely access to the court system, improve, access to justice, help you reduce corruption. There's plenty of data to do that. And we've actually studied this, but there's a lot of bias in the data. And ironically, one of the biggest biases we saw was the more hungry the judge is, the more harsh they become in their ruling and sentencing. So how do you account for that hunger bias? So, we started thinking like, could we look at a timestamp and say, okay, can we make some correlation or, some adjustment based on that? But we don't know if that judge had breakfast that day or had a large lunch or a small lunch. Now that might impact and then different metabolisms. So there's a level of, unfortunately, bias we're going to have to just live and accept with. We already do. But the best way to try and reduce the amount of bias in our systems is to actually have very diverse training teams. So diversity of background, diversity of ethnicities, diversity of perspective. That's the way we found to be able to uncover at least some of these biases so that we can actually deal with them in the training. But the harsh truth is we can never eliminate bias from everything. It's just, right now, it's not possible.
Okay, thank you. Very insightful. Very insightful. Okay.
Maybe I can add a little to what Neil just said. So,
okay.
Just to also add that it's important that to minimize bias, the way the data is collected is actually very important. We need to take a look at that because in most African settings, the way data is collected is there are a lot of bias is introduced. The data is not of good quality, and if you use data that is not good quality to actually train a model. It's going to replicate whatever guide it has from the data. So it's important to collect data well, have systems that ensure quality data, has systems in place that ensure that human error during data entry or during data capture is minimized to the barest minimum. Because if bias is introduced in the data capture or data entry or how the data is collected, ultimately it's going to show up in the model, the way the model is trained. So that's also really key when we look at the bias aspect of AI. Thank you.
Okay, thank you. Thank you, Otsi. Are there any more questions? Okay, Omowole, I can see your hands up. Do you have any questions?
Yeah, so from the chat, question for Sauta by someone named Combo. So the person while they was giving a presentation.
Okay, so this question is for Nell by Combo. Okay, it says thanks for a short and elaborate answer on AI. How can artificial intelligence be leveraged to improve healthcare accessibility for rural communities, especially in low and medium income countries? How can artificial intelligence be leveraged to improve healthcare accessibility for rural communities, especially in low and middle income countries?
It's a great question and a really important one, given there's a lot of tools being built and there's a lot of questions about accessibility. There's a project going on right now among some of the African countries, their health agencies, and some NGOs, where what they're realizing that lack of nearby or affordable health resources is becoming more of a challenge. And one of the things we're actually working on is, can we take a self-contained tablet, like a mobile tablet? Can we just put AI on there so you don't need like a internet connection? But the AI knows enough basic like first aid care and some things about common illnesses in the area, so if someone gets injured or they fall sick, then anybody from that town or village can take this tablet. The AI can prompt questions, it can use the camera or the video to help kind of assess, so that you essentially can turn anyone into like a physician's assistant. So it's limited amount of care, but you can provide more immediate assistance. And if it is serious, then alert and say we have to get this person to a better facility. So there are things like that that are going on to essentially make, I'll say, the average non-healthcare person to some degree proficient, so they can provide some quality of care. The other things are actually trying to integrate some of these AI tools into the hospital systems in rural communities so that they can elevate their level of care. One place this has actually already happened is in China, where if you're like in the western part of China, which is very rural, they've been actually able to elevate the quality of care in these hospitals to the same level that's like in Shanghai and Beijing. So I know it's not all the way there, but we're looking at trying to build some of these tools, given the infrastructure that's actually available, that are actually useful. I think over time, as more and more people start, building tool sets and trying to solve, small problems, that in the aggregate will overall improve quality of care for these communities. So it is a major focus, I can assure you of that. It's just, I think everyone wishes we were moving faster on it.
Maybe I can add to this too, if you allow me. So 2 examples from a Nigerian context. Yeah, Dr. Neil already spoke to one about telemedicine. I know that's happening in most locations in rural communities in Nigeria. And the interesting thing is that you can access, with your mobile phone, you can access these platforms as little as $500 the last time I checked. The other thing is one of the state governments in Nigeria has signed a contract with a company called Zipline, and they're able to deliver drugs using drone technology and AI to deliver drugs to creeks where it might take days to be able to access, because there are no roads. You have to use maybe boats or something to get across to those communities. They're using drone technology and AI to actually deliver drugs to these communities, and it's making it easy for people that geographically they're marginalized, they're unable to access healthcare, but they receive their own drugs based on that initiative. So yeah, these are the two examples I have. I thought I should share.
Okay, thank you. Thank you. I think I have another question. This question is for Nell. It says, you mentioned you need domain knowledge to work on AI. In the context of the interaction of AI/data science/public health, how can that be applied in Africa? Do we build teams with experts in each of these fields? Did you get my question?
Yes, I did. So great question. Simple answer is yes. So it's true in Africa. It's true in most parts of the world. You have to build up these different competencies. So you need people that understand like AI, machine learning. You need people that are really good at data science. I mean, just thinking in general is moving to data-driven decision making. But you also need the domain experts. You need people from public health. You need doctors. You need nurses, clinical researchers. You need dentists. All the people that are actually on the ground doing the work, because they actually understand what's actually happening, what the actual pain points and needs are, where the opportunities for some of these tools would actually create benefit. There's a lot of smart technologists, a lot of smart engineers, a lot of smart data scientists. They just don't live in that world on a day-to-day basis. They just don't understand that. And that's why domain experts are so important. I can tell you that, and we saw some good examples from those speakers, that AI is used everywhere, every industry, every sector. The most successful companies are the ones that were started by the domain experts. The most successful legal tech companies were started by lawyers or paralegals or judges. The most successful marketing companies using AI were actually started by marketers and salespeople. It's no different for healthcare, and that's why. And I know I see a lot of it, unfortunately, is that there are a lot of people kind of just waiting, saying like, well, I'm waiting for Google or Microsoft or some of these guys to build something for me. They just don't know what you're going through. They don't have that kind of subject matter expertise in-house. That's why the ideas, the drive, the vision, all has to start with the public health people.
Okay, thank you. Thank you, Nell. Thank you again. And I have another question. Now, this question is for Nell or any other person. Any other person can answer this question. It says, what are the ethical issues with using AI for giving medical advices? What are the ethical issues with using AI for giving medical advice?
I'm happy to go first. I mean, there's a lot, especially in healthcare. We're very concerned about accuracy, or something that might lead to misdiagnosis. There's no AI tool, and there's no one advocating that AI is the one actually making the diagnosis. All it is providing information, so more data points for doctors and nurses do their work, make their decisions. Like, ultimately, diagnosis and treatment still lies with the physician. So there's a lot of investment made by all these organizations to help build truth and trust in the technology. We really train, in some cases, overtrain these tools to try and avoid some of these accuracy issues. But that's one of the biggest fears, is that it's going to make a mistake. And the truth is, it will make a mistake. It's never going to be perfect. It doesn't have perfect teachers. It's just a question, is the combination of human doctor and the AI tool more accurate together. And we've seen some of that, like being able to detect lung cancer from x-rays. It used to be about 50% by a human radiologist. Now with some of these AI tools and the human radiologist, it's about 90%. So that's really what we're trying to aim for here, but we're not trying to substitute out human healthcare professionals with machines. We're not advocating AI make the diagnosis, just provide more data points for the healthcare workers.
Thank you, Neil. Thank you for that response. Okay, so I have another question, and the question.
May I add two short things?
Okay.
For me, there are two other very important ethical issues. The first one is kind of a global one. It's each time you have the choice between using AI for giving medical issues and using, let's say, human beings, you have to choose AI when it is better. Just that, when AI is better than humans, you have to use AI, and when humans are better than AI, you have to use humans. And the second ethical issue is, and this is a very important one, is that at the moment you have the possibility, some people have more possibility to use medical advice than others because AI software is very often commercial AI software. So the ethical issue is how to have AI accessible, medical AI accessible to everybody and not to a few. So how to have open source, among other things, open source medical AI. And I think this is especially important in African countries where most people cannot afford to have to buy or to pay for commercial AI. That's it.
All right, thank you, Didier, for that. Thank you so much. Okay, I have a question here for Dr. Azuma and any other person. It says AI is necessary in Africa to address the medical needs of the community, such as access to care, shifting from sick care to preventive care. Explain how to shift from sick care to preventive care in African context.
Wow, that's a very, thank you for asking that question. I would suggest that why we focus more on sick care is cost, right? Because when you're struggling to meet your daily needs, such as sustenance to eat, you don't want to spend money to just go get a checkup. You don't want to spend money to just go get your teeth cleaned, right? So it's more of the need stratification. And to most people, they don't see the necessity to go see a doctor when they're not sick because they don't have extra money, or because we don't have, universal healthcare, at least let's say in Nigeria, and we don't have that. So if we had that, then most people will be able to go see their doctor. But we know that prevention is just better than cure. And that's where we're shifting medicine. Medicine used to be more pathological, treatment of pathology. But as we advance in medicine, we see prevention is better than cure. You see DARE's organization, Healthy Aging, right? Aging is not a disease. It's just you have to prepare for it. So similarly, it's just a cultural mindset. It's just a financial constriction that prevents us from getting preventative care or preventive care. We know preventive care is so important. And with AI, we can do that through checking your blood pressure remotely, or even just as one of our speakers talked about change management, right? So we just have to change how we see things. We have to change how we implement medicine, because we can teach people through machine learning what basic preventions they can do at home, right? So preventative care is knowing your blood pressure, knowing your weight, knowing your cholesterol level. Maybe we don't need to do that in a healthcare facility. Maybe we don't need to do that in a clinic. Maybe we just need to use social media and send equipments to people's homes. Maybe we need to build more community centers in our communities that can do that, not requiring a physician or even a nurse, maybe a community educator. For us to switch from sick care to preventative care involves innovation. Apart from artificial intelligence, it involves us thinking outside the box with a mission of having a healthier Africa. Thank you.
Okay, so thank you, Dr. Azuma, for that. I really appreciate. I have a question regarding the underutilization of AI. I just guess that I got that right. So, but this question is for Dr. Nell. I'm going to also post in the chat. So, a moment. And that's in a moment. All right, so like the theme of this conference itself is how to optimize. We are looking at optimizing the healthcare problem in Africa, for instance. And when we're talking about Africa, we're not just looking at the countries in Africa alone. We have those kind of communities all around the world that are just trying to embrace technology to solve more problems. So, Dr. Nell, you mentioned something about we're using just 20 to 30% value of AI, paraphrase though. So, what can we do to change that narrative, especially in the context of the theme of this conference? How do we optimize? So, I'm guessing if in the developed world, for instance, where we have lots of AI engineers, if they are only just getting like 20 to 30% value of AI, then I'm wondering what we are getting in Africa from AI. So the exact question is, how do we optimize AI? If we're just getting or doing like 20%, how can we move from like 20 to like 40%? Thank you.
Yeah, no, it's a good question. I mean, one is to get away from just trying to replicate what's already out there. Africa is actually a great example of the ability to leapfrog. If you think about mobile technology, like there was no real landline infrastructure like you saw akin to Europe or North America. Rather than try and replicate that as a step, there was a big jump in towards mobile, and that's why actually Africa is very advanced when it comes to mobile apps and like mobile payments. There's a similar type of thing here where you don't have to try and replicate what other people have done. There's an opportunity to leapfrog. But to build that foundation, it's not just about, how do we do something different, how we think differently. It's also building some of the infrastructure, and some of that is actually around what we've been talking about, the data. You need the data to teach the AI. That's got to be a very foundational step. So if you're really trying to like 2x that, start optimizing, yeah, you build the workforce, you do these other things, but you need to have the data, the subject matter experts, and people looking at their normal jobs in healthcare and saying, like, I know these are the problems. In an ideal world, how could I solve that? Rather than just accept the problems or the workarounds. If I had free reign, feasible or not, how would I really prefer to do that? And that's the way to start thinking about this to unlock more of the value for AI, because it has these new capabilities. Some of those things that we thought were not doable, not feasible, are suddenly now feasible. Like I hear from a lot of people that they never would have imagined the machine could read the emotional state of a person, but it's body language. It's what we call kinesiology. It's word choice, it's tone of voice. and AI has that laser-like focus, we can actually get a much better assessment of a person's like mental state that way. We've ironically found that people are more honest with AI chatbots, that they'll tell the chatbot things they won't normally tell their doctor, because they feel like if they speak with another human being, they're being judged. And so suddenly AI becomes a much more interesting way to get meaningful, true data from patients. So these are the opportunities we have to really start understanding and looking for. I wish I could just give you a list, but unfortunately, this is not how it works. So we kind of be a little bit more open-minded, but think about, again, we know how we do things today and why they may not be necessarily broken. Is there a better way of doing this? And that's how we really start, upping that percentage of value from AI.
If somebody thinks that he's speaking, he or she should unmute him or herself. But I see that Agbolat was falling because of technical problem. Voilà, he's back now.
Hello, everyone.
Yeah, hello. Go ahead, Agbolat. I saw that you had technical problem. So yeah, it was the first. Yeah, go ahead.
Okay, all right, thank you. So yeah, so I got most of the things Nell has shared, and somewhere in my mind I'm just connecting the dots. So the next question I have is for Mr. Olsted. So Mr. Olsted said everything is not data, everything is not about data. And then Dr. Nell also buttressed that point that you just don't need the data. The data is very important, but you also need domain expertise. You need people who are experts in the field that you're working on. So my question goes to Dr. Ose. So you said, so everything is not about data, everything is not about AI. Solving this or optimizing public health in Nigeria and Africa. Apart from the data and apart from getting experts to work with, what else do you think is needed to really optimize healthcare, public healthcare in Nigeria and Africa?
All right. Thank you very much for that. So I close with a statement that say that AI will not solve all our problems, considering the fact that a lot of people now think that because we have AI, it should solve all our problems. There are a lot of challenges that we have to address as Africans, because if we don't address those challenges, even if you use a model or you use artificial intelligence, it's still going to give you garbage in, garbage out, because the data you use in training that model that's the data that the model is going to use to make predictions. And when the data is not correct, like I said earlier, if it's not of good quality, then it affects it defeats the whole purpose that we're trying to achieve. So first, we need to be sure that we have good quality data. We need to be sure that we have people that are trained to do the work that they need to do. We need to ensure that there are clinicians that are available to provide services to clients. We need to ensure that infrastructure is adequate. So all these things are critical. Even AI is not going to solve all these problems for us, but government policies, government policies and actually right investment will help make some of these things available. Training of of healthcare workers, retraining healthcare workers is going to make this possible in this context. And then if you have this aspect taken care of, and then you layer on artificial intelligence using the data, the good quality data you've collected, this will make us have better health systems and better health outcomes. Talk about supply chain. You have good data for supply chain. You have good data for logistics, and you feed those data into the machine or the algorithms. It's easier for the algorithm to make better predictions using good quality data. So it's important that there is quality, and the people that make those quality data possible are the healthcare workers and the systems that you've built. So you need to be sure that you build the adequate systems to ensure that the data is of good quality. There are processes that ensure that data is of good quality. There are processes in place that ensure that people are well trained and mentored and given the right tools and given the right support to work in the space that they have been given to work in. Without that, using machine learning or artificial intelligence, we might not get the result, or it might not achieve the purpose that we need it to achieve, but we need to get the basics right. Thank you.
Sorry, thanks for that. Okay, there's something I've discovered. As someone I've worked with various machine learning models before, most of the data set I've used are from research organization from the West. For example, in the US, you have Stanford University and some other university providing this data set. I think universities in Nigeria and Africa, most times, they don't involve in this kind of research. We expect them to be doing this kind of things, not just the average medical doctor in one hospital like that. Mostly they don't have that time. But we are expecting university to actually step in, get this data set and make them available for open source use. We're not saying that they should be proprietary data, just open source, then let our university contribute as well. But they're not doing that. I think there should be a way to actually involve them. It starts from the schools, universities, colleges, and all of that. So I think there should be a way we should involve them in it. They are the ones that have that time to do research. They have the students to help them in data gathering, all of that. I don't think we should be expecting much from the medical doctor who is just practicing in one hospital like that. We're not going to get much from them. But there's a way we can involve schools and various laboratories in the country. I think that's a very good start, because I've worked with so many data sets, and most of them are from research institutions in America and Europe. And they all, we have one for leukemia and histopathology data, and they are from universities. Cancer, different kind of cancer, pathological data, they are from universities. And people are using them to, write their research papers, their theses, all of that. But we don't have that here. I think our schools need to step in. So that's just what I have to say.
Okay, so thank you, Mr. Otse and Helen. So Mr. Otse, so the actual word you use is that AI is not a magic bullet, something like that. So I like that word. So I'll take note of that. So because I've noticed that, like, at times people just think about it like AI is everywhere. So if I introduce AI to anything I'm doing, it's going to automatically solve the problem, So I appreciate your feedback on that. And then also, Helen, talking about how academic institutions need to step in. Now, on that, I think lots of universities in Nigeria have students, and those students, they do research paper. They do their projects, they do theses, they do dissertations, and all of that. But I don't want to go into that direction now. So the question I have for you, Mr. Helen, is this. You mentioned something about data from social media. All right. And then I want to contrast that with what Mrs. Ifoma said. She said something about data. She said, we have lots of data. I guess maybe in Nigeria or talking about Africa. She said we have lots of data, but we don't know what to do without data. All right. So Helen, do you think that is correct first? Do you think in Nigeria and Africa we have lots of data, but don't know what to do without data? That's number one. Then the second question I have mentioned something about gathering data for. So in the real sense, let's say I want to solve a particular healthcare problem in Nigeria, for instance, let's say Ebola, all right? So how can data from social media help me in training an AI model that can be useful for people who want to know more about the problem and possible solutions? So I hope my question is clear, Mr. Allen.
Yeah, okay. Let me take the last one first.
So thank you.
Yeah. So let me take the last one. I believe you can hear me. So the social media data gathering. Okay, let's look back to when COVID-19 came out in 2019. Some of us were working on a project that can help track how far it has spread, in different part of the world. So that very data they were all collected from the internet, from social media mostly, where we track what people are saying, like sentimental analysis to see if the severity of the case, sentiment analysis is all about detecting positivity or negativity in a text. So we use that to actually track how far it has spread. And areas that are also contained it, we can also use that to track how far areas that are already contained in all of that. So when it comes to social media, it's all about tracking the spread of disease or virus, and also how to contain them within a particular region, where the outbreak happens. So that's where that comes into. It's not like you're gonna get any kind of biological data from social media. Nobody shares their biological data on the social media, but people can share what happened, what's going on in their area. Like during time of Ebola, we have a lot of people from Nigeria going to the internet, cases in their area or not. The same thing also happened of COVID-19. We can use that to track how far, and also tell people that, look, this area, you shouldn't go there. There's an outbreak in our area, something like that. So social media is a very good tool for that. We can get a lot of, sentiments data from social media regarding outbreak or disease control. Then when it comes to, and let me just add one more. With such data, we can also track how far it's spreading using, doing all sort of mathematical calculations to actually know the rate of change of that very disease, how fast it's spreading, and also to know how the area it might go next. Using predictive model, we can actually predict, okay, with this very momentum, we expect this very outbreak to reach a particular area. So that's it. So all these things, social media data can help in that. Then coming to if your question or statement regarding data availability in Africa, I might say yes, we have data, but one of our major problems is that we don't know how to maintain or curate data. I think that's our major problem. We don't know how to curate them either in electronic form or in a form that can be trained using AI model. For example, let's talk about hospitals. We have a lot of files, medical files in the hospitals with several, electronic, most of our doctors get electronic data from this from electronic device, but they still enter those data on a paper. Instead of saving them on the computer, they still want to put them on a computer. So on the paper. So because of that, we can actually, curate this data for predictive models. So they are data, but we don't have them ready for predictive model. So I think the major work is actually bring this data together, curating them. I mean, using domain knowledge, just like some of our speakers have said, using domain knowledge to extract the right features from this data so we can make accurate predictions from them. So I'll say yes, there are data, but we don't know how, we still have problem bringing them together and curating them for predictive models. I think that's also one of our major problems. So, yeah.
Okay, all right. So, Mr. Allen, thank you for your input. That goes a long way. Although I still have more questions regarding the use of social media, and all of that, but because of time, we just leave that for now. There's a question on the chat, but I just quickly want to ask Mr. Otse a question. related to what Mr. Allen has already said. So, Mr. Ose, you mentioned something about data fragmentation problem, right? So, what do you think is the solution to the public health data fragmentation problem in Nigeria and Africa?
Thank you very much. So I think for a start, the government needs to take leadership in trying to integrate all our data systems, particularly starting with the Ministry of Health. We need to have government leadership clear and strong in that space. So we need a government entity that will lead the integration of data, starting with the health sector. For example, the Ministry of Health. If you want to look at which entity in the Ministry of Health will lead data integration. So NCDC, which is an agency of the Ministry of Health, they have their own surveillance system, which does not directly speak with the other system in the Ministry of Health. The National Primary Healthcare Agency, which is also an agency of the Ministry of Health, they have their own immunization vaccination system, which is different from what the Federal Ministry of Health uses. HIV, TB, malaria, they all have their own system. So we need the government to take leadership and say, okay, bring everybody to the table, and then you provide that leadership. That's one. Then there needs to be an assessment of all the, an assessment or an inventory, if you want to talk about it, an inventory of all the digital tools or the systems that exist within this space. And then we can now develop a plan on how to harmonize and bring them together. Sometimes we might not be able to integrate all these tools because disease areas have peculiar needs that they want to maintain. Something as simple as developing an interoperability layer that connects all the systems together will be really, really key, because, and then we have a unique identifier that identifies that one individual that is HIV positive is the same individual that had TB, and is the same individual that had high blood pressure, and is the same individual that had maybe malaria, or the same woman that is taking her child for vaccination in the clinic. So we need like an interoperability layer that connects all the systems together. That's one. Then we also need like a unique identifier that identifies each individual as unique. And then we need to sustain the momentum of collaboration, because if we don't have this momentum of collaboration with the leadership, like I said, the entity that's going to provide this leadership will have. If we don't have that momentum, it will be difficult to make this thing happen. So first, we need a government agency that will lead it, or a government department that will lead it, a Federal Ministry of Health department that will lead it. We need to take an inventory of all the systems that we have, develop an interoperability layer, collaborate more, and engage more. Over to you.
Okay, yeah. So thank you, Mr. Odse. Wow, that's very interesting. In the future, we'll try to get some representation from government, so as speakers and also as guests and participants, so that they can be involved. All right. So thank you very much for that. So Mr. Otse, so do you think we really need a very good database management system? Because you talk about unique identifier. So are you saying we need a very robust healthcare database in Nigeria and Africa? And then because one thing is to have a database, then another thing is how to now share the data so that researchers can probably mine the data and get some information and all of that. So, but the exact question I'm asking you, Mr. House, is, do you really think that we need just a central healthcare, public health database management system for Nigeria as a country and other African countries, so to speak? What do you think?
Thank you very much. See, if this question would have come like maybe 15, 20 years ago, I would have said yes. But right now, we have a lot of data systems in Nigeria or across Africa that we cannot just say we'll streamline all of them to one. What we need to do now, that's what I talked about, the interoperability layer. What we need to do now is to see how all these various systems can speak to each other. I know countries have been talking about something like a data lake, where you have like a repository where you put all your data inside. What we have in most African countries now might not be possible, but we need to create an architecture where all these systems speak to each other. Because, like I said earlier, there are peculiarities that exist within the disease areas, and some of these disease areas want to maintain their peculiarities. They want to maintain the robustness of their data collection system. They don't want to drop any. So let them have whatever they want to have, but create a platform where all these systems can speak to each other. Then I think that would be the best approach to this, in my opinion.
Oh, okay. So thank you. So we're rounding off now. So just two questions. One for Didier, and the other one was a question in the chat. So Didier, please, real quick, what can you say about privacy? Because when you talk about people having lots of data, so we want to be sure that those data can unshake at some point. If I'm an organization and I have my data, then I should be able to unshake with your own data, all right, without losing my privacy, without losing the security and all of that. So, DJ, so what do you think can be done? When we talk about having lots of data and then trying to look for a way to handshake with each other, without necessarily not respecting the privacy of each data source. So what do you think can be done about that real quick, please, DJ?
This is a very large question and very complicated. But yeah, I would give first a kind of a more general answer about, privacy is something important, but privacy is not more important than other human rights, and it's not more important than the right to health. So the important thing is to ensure that when people share data, it is not going to be used against them. So it's not going to be used to sell things and so on. And if you have a system where you have a guarantee that when people are sharing health data, they will not have problems. It's going to work. And normally, at the let's say at the European level, there is something called the European Health Data Space, and this is the goal of what they are organizing. And it should be also something that is, I think, a goal in African countries. And maybe in African countries, it can be easier because you don't have you have less less layers of regulation than there is in Europe. So that's one part of the answer. And now maybe another part of the answer is, yeah, if you can anonymize and pseudonymize the health data enough, then you have less problems of privacy. But yeah, this is your question, Agbola, is a very large question, and my answer is only a small part of the answer.
All right, so yeah, thank you, Didier. So I appreciate, well noted. Yeah, so there is a question in the chat. Fortunately, I can't see that question again. Wow. All right, so someone asked a question on the chat, but I can't see that question. I want to read it out for someone to just address it before we leave. But if someone else can see that question, you can probably just read it out. the person was saying that he works with an organization and they have data and they're using some tools and all of that. But I can't find the question now. Then while we wait, so is Brenda there? Brenda, are you still there? Hello, Brenda, are you still there? Hello, Brenda, are you there? Okay, so in the absence of that, if anyone has anything to say, the person can just share right now because
I don't know what you're talking together.
yeah, to close now. So does anyone have any contribution or any question? Just something to add in like a minute before we end the program.
Yeah.
So real quick, please speak with just a minute. Thank you very much.
Can you hear me?
Go ahead.
Yeah. Okay. I think some of the changes need to start from us, which is why I'll propose that it's time Longevity Nigeria have its own GitHub repo. You know, where some of these collaborations can be made either by codes or data. Yeah. Also, yeah, I think it's that time we do that.
Okay, thank you, Mr. Allen, for that point. Yeah, really appreciate. So the next person, she's Godswill. Please add your contribution question real quick in just a minute, please. Thank you.
Okay, can you hear me?
Please go ahead.
Okay, good evening. Thank you so much for this session and everything. I just wanted to ask, well, would there be a follow-up on this? Would there be, I've had all the perspective, would there be a practical training, a follow-up where we can upgrade our skills in data science and AI? I'm just asking. Thank you.
Okay, so thank you, Mr. Shisam. So we're going to do something next year. No, obviously not this year again because we have a couple of things lined up. But definitely we'll be doing something next year, and then we'll send email to everybody that participated in this event. Thank you. Yeah, so
please keep us updated. Thank you. Thank you.
Yeah. So Didier, please.
Yeah, first, Agbola, thank you for organizing this once again. And I think it was really useful, and I hope that there will be other Zoom meetings in the same kind of thing. And one of the aspects that I'm following, I will put the link again in the chat. It's something called Longevity GPT. And so this is a kind of ChatGPT, but for longevity, so for healthcare, for longevity. And I hope that some of you will come for activities related to this. Please, if you are interested, take contact with me and copy paste my email address and also the URL of Longevity GPT. That's it.
Okay, yeah. So thank you, DJ. So you can just give us that link. So there's one last question we'll take, and then we'll call it a day. So this question is Tolu from Mr. Tolu Opadele. So he's saying, what tools can be recommended for capturing of health data for research independence? For research independent of a hospital EMR system. So, Mr. Tolu, does your EMR means enterprise management system or what? Just to be clear, Mr. Tolu Padili. Anyways, Mr. Allen, can you answer that question? Mr. Allen.
Yeah. I think what it meant is EMR, that's electronic medical records. Yeah. Yeah, okay, you talk about the tools to capture. These are, they are depends on the medical conditions. Various medical conditions have their various tools they're using collecting this data. And these data they are numerical data most times, and you need to enter them on a CSV file or Excel, for example. So after collecting those data, you enter them on Excel, then or a CSV format. That's where you start making your predictions, or probably first of all curating it for predictive model, meaning adding labels, to various features. They add labels and all of that. So I think it depends on. I don't really know the medical condition, because each medical conditions have their own various electronic device in these medical records. So I don't really know, but I know that after this data, you need to tabulate them. Yeah.
Okay, so Mr. Allen, what you do is just put some of those tools in the chat. So we'll call it today now. So I just really want to talk about the next project we're working on. So we'll be working on a project called OLIVE, OLIVE, and OLIVE means it's an acronym for the oldest living Nigerian. So the rationale behind that is that in Nigeria, for instance, we celebrate beautiful people, most beautiful girl in Nigeria, most beautiful girl in the world. We celebrate entertainment, sports. This time around, we want to change our narrative somehow and say, okay, let's look at the oldest living Nigerian. Let's begin to look at that direction and encourage some research along that line. So apart from looking for the oldest person in Nigeria, we also want to use the opportunity to research more about caregiving for other living Nigerians and all of that. So we will be posting that we send everybody email when that comes up. So with your permission, please. And anyone who is interested can join us. So thank you, speakers. Thank you, panelists. DJ, thanks a lot. Alan, thank you. Mr. Ose, thank you. Mrs. Ifoma, thank you for your time. Brenda, thank you. Chiraz, thank you. Everyone, we appreciate you. Thanks a lot. And we'll keep you posted once we have updates. Thank you, everyone.